Hi, my name's Dr Simon van Rij and I'm a urologist here in Auckland, New Zealand. I have a particular interest in prostate problems and perform a number of different treatments including TURP, laser or HOLEP, REZUM, Urolift or robotic surgery. Each week I specifically have men come to see me asking which is the best treatment for their urinary symptoms, and in particular should they consider some of the newer options or treatments. Now, usually that starts off with, I know I shouldn't Google, but I found this, and I always say to patients and people, hey, you should Google your health information because the more you know about your condition, the more informed you can be to make the decision that's right for you. And so I created this video out of the many consultations that I've had with men about the urinary symptoms. Now, the internet is a great thing, but unfortunately it doesn't always apply to each one of us in our own situation. And that's why I created this video. So the important thing to say from the start, that this is just my own opinion and should not be taken as medical advice, and seeing your own doctor as appropriate to guide you is very important. So, what's different about my video? Well, I'm going to present all of the options. Sometimes some videos just present one option because it's sponsored by the company. Secondly, I'm going to be specific to New Zealand, because though the internet is great, some of these videos are not what happens for us here in New Zealand. And thirdly, I'm going to actually talk about the procedures and give you some idea of how I go about a normal consultation and when we're deciding what's the best treatment for people. And this is the first diagram that I use. And I use this to talk about men's urinary symptoms. Now, what are men's urinary symptoms? Well, they can be each different for all of us. And the important thing to say is that they can present differently and can cause different bother for each person. For many men, it may be a poor flow, dribbling, not being able to get going, getting up a lot in the night or even more, finding they have the urge to go but just can't hold on, or knowing where every toilet is or having to stop every time just to be safe. Now, I use this diagram because it shows two pictures. The first is a healthy, normal bladder and prostate, and you can see the bladder here there at the top, and the prostate with the pipe running through called the urethra. Now, the prostate's job is to make semen, and only males have a prostate. As we get older, we know that the prostate gets larger. Now, why do some people have large prostates? Well, just like some men have large hands, some men have large prostates. And often it's not something that we can necessarily control ourselves. But it is really important to know about the size of your prostate because it will have a big impact on what treatment you should have. Now, as we see in the top diagram, the bladder is healthy, it squeezes, the urine flows out through the nice wide passage. But as we get older and as the prostate gets larger, things change. You can see the prostate now pushing up into the bladder, blocking the pathway. You can see the bladder is having to work harder to squeeze the urine out, and it becomes more irritated. In some men, it can become so pressured that it can almost overstretch like a balloon, and therefore then it doesn't completely empty properly, and that's that feeling that men can get. It's important to know about these symptoms because it has a big impact in terms of what you should do. Now, the next thing to say obviously is, where does cancer fit into this? Because as soon as we say the word cancer, quite rightly, we all become very anxious. But as I say to many men who come to see me, prostate cancer does not cause urinary symptoms unless it is very advanced. Now, as you can see on the diagram, prostate cancer actually forms on the outside of the prostate, and that's why it doesn't cause symptoms for a very long time. And that's why if you do want to investigate further if you have cancer or not, you should consider whether or not you should have a blood test called a PSA and a back passage examination by your doctor. Now, that's a whole nother video in itself, but it's important for you to be aware that those are what we're looking for from a prostate cancer point of view. In men who I see who've had the blood test, who've had a back passage examination and they're normal, I'm usually very happy to tell them that I'm not concerned about cancer and we can now focus specifically on their urinary symptoms. To assess how bad your symptoms are, we use a standard questionnaire. It's called an IPSS. The great thing about doing this is it gives us a good assessment of where you're at and can be used in the future to assess your response. When you come to the clinic, we may often also do some other tests to really try and personalise to your care. One of those is called a flow test. Now, a flow test involves you having a full bladder. So before coming to your appointment, make sure you've drunk plenty. 3 to 4 glasses of water is great. And try not to pass urine too close to when the appointment is. If you arrive at an appointment and you feel full, you can always ask and do your flow test before your appointment to be seen. This here is the machine that you pass urine called a flow test, which gives us a really accurate idea of if your prostate is blocking or not. And we can also then use an ultrasound after you've done this flow test to assess how much fluid is left in your bladder and the size and way your prostate looks. Now this is really important because if you're retaining a lot of fluid, it just shows how much pressure your bladder is under from your obstructing prostate. Traditionally, when all we had was one operation, a TURP, it didn't matter what your prostate looked internally. But now when we're deciding between these different options, in particular for the REZUM and the Urolift, it's important for us to know what the inside of your prostate looks like. And that's why sometimes we may discuss with you doing a short procedure in the clinic called a flexible cystoscopy. This involves a small telescope being placed down the pipe that you pass urine under local anaesthetic gel. There's no special preparation and it takes around 10 minutes to do. You can return to your normal activities that day. So when it comes to making a decision about treatment, the key thing that I tell all men is it is the bother that the symptoms cause that should be the main reason why you make any decisions. Just because you have a big prostate does not mean that you have to have treatment. You may be more at risk of treatment, but does not mean that you have to have treatment. Now, when men come to see me, they've generally been on medication and supplements, and so I'm not going to talk a lot about those today. The only thing that I would say is that if they are helping, carry them on. If they're not, or they're causing side effects, then consider your options. Now, there is actually a new growing group of men who look at this and go, hey, I'm young, I don't want to take a tablet for the rest of my life. Is there one procedure that I can have to get me off the medication? Now, in the past with TURP, that option often was too big a jump. But with some of these newer techniques, it's opening the door for that. So, what should a prostate procedure do? Well, obviously, it should unblock the prostate to improve your urinary symptoms while not affecting your sexual function or your lifestyle. Now, unfortunately, we know everything in life is about trade-offs, and there is not one procedure that is perfect. And often when I start this discussion, I talk about this. So medicine unblocks your prostate about this much. And for many men, that's all that they require. A TURP or a laser procedure unblocks you this much, so much more of an effect. And I find the REZUM Urolift kind of sits somewhere in the middle. Now, the important thing to say is some men do need this full deobstruction. And so if you have a prostate that's causing a lot of retention of urine, or your symptoms are very severe, or you even have a catheter, then we may talk about whether or not you should be having a TURP or a laser procedure. So, what is a TURP? Well, I've got an animation here. And a TURP is a very effective procedure. It's been around for many, many years, over 30 years, and is the most common operation performed in the public hospital for urinary symptoms. The advantage of it is that it does quickly remove tissue, so deobstructing the prostate is done well. But the downside is that it can have some side effects, in particular the risk of bleeding and the effect on ejaculation or sexual function. What's the difference between a TURP and a HOLEP or a laser? Well, in essence, it's just the way that we cut away the tissue. So here we have, again, another diagram or a video showing us cutting away the tissue with the laser. For me, I think there is some advantage to the laser, particularly if you have a larger prostate, as there is evidence of less bleeding and that you can remove more tissue. When you've got a smaller prostate, I think the advantages are less, and it's about weighing up the pros and cons that suit for you. Laser is often performed less commonly because there is some technical aspects to it from a learning curve perspective. Thankfully, most men don't need to go all the way to a TURP, and they can consider their other options. And that's where REZUM and Urolift come in, and I'm going to talk specifically about each one of these now. The first thing to say is that both these procedures in New Zealand and Australia are generally performed in a theatre environment under general anaesthetic or sedation. You may see some American websites that show these being performed in a clinic under local anaesthetic, but that's generally not what's happening here. So I'm now going to move on and talk about each one in its step. So we'll start with the Urolift, sometimes called the prostate urethral lift. This involves placing a telescope down the penis and using small implants to pull apart with tension the prostate to create a tent or wide opening. It's done as a day procedure in our day theatre and takes about 15 to 20 minutes. You go home the same day, and for many men go home without a tube or catheter at all. Some men we do send home overnight, and then we get you to come back the next morning for our nurses to take that out. We give you plenty of information about all this, and we have a very experienced team. The aftercare for the Urolift actually is probably the best of all of these procedures, and I find that men do get back into their normal activity very quickly. The main issues that often they may have is 1, they pass some blood in the urine, and drinking plenty of fluid is important, and 2, they have some irritation or burning when they pass urine. Now, what are the downsides? Well, it's not going to unblock you as much as a TURP or a laser procedure, so some of the effects may not be as dramatic. But often, as I said, most men may not need that complete deobstruction. The second is its chance of having to have further treatment is slightly higher than some of our other procedures. If we look at the 5-year data showing how many men have to have further treatment, it's somewhere between about 5 to 15 or 20%. Now, that's still extremely low, and the important thing to say is that even in men who have to have further treatment in the future, it's not compromised by having had a Urolift, even if you have to have cancer treatment. So, who do I think are the people who should have the Urolift? Well, if you're concerned about your sexual function, I do think that it's very important you consider this, because we're not removing tissue. It means that we're having the least effect on sexual and ejaculatory function. Men who have moderate to smaller prostates are who I would generally recommend for the Urolift. And it's not that we can't do the Urolift in men with large prostates. I just find some of the outcomes with other techniques improve when the prostates get larger. The other thing, and that's part of the reason why we do that flexible cystoscopy, is men who have what we call median loads, or the bulging into the prostate, sometimes can be more difficult or have less pronounced benefit from the Urolift. Again, it's not that we can't do it, but it's just at this point sometimes I would consider some of the options that are available to you. So, having talked about the Urolift, now let's talk about the REZUM. REZUM uses steam injections into the prostate via a telescope down the urethra. This short 10-minute day-stay procedure uses the natural energy from the steam releasing energy inside the prostate to cause reabsorption of this tissue over time to create a nice wide opening. This is not a quick fix. Because the tissue is reabsorbed, it takes time for its effect, and that can take about 6 to 8 weeks. The needles are very small and the risk of bleeding is low, but there is some initial swelling of the prostate, which is why we leave a catheter. Now, that catheter can be different and can be in for a different length for each person, and we tailor it often to the size of the prostate, but it can be usually anywhere between 2 to 10 days. Now, doing this procedure a lot and having a nursing team who know how to manage these catheters is extremely important in this initial stage. Now, as I said, this is not a quick fix. This is an improvement over a period of time, and I usually get emails from my patients 2 or 3 months down the track and saying, I'm really glad I had the procedure, but those first 2 weeks, they were quite tough due to the irritation and having had the catheter. Now, as I said, it's not for the short term, but for the long term, and that's where the REZUM really does come. Because the tissue is being reabsorbed, we do create a nice wide opening. And it is still only a day procedure, and you'll be up and into your normal daily activities very quickly. In terms of retreatment rates, they are slightly better than the Urolift in the published data, and that is, I think, in part because we are removing tissue. In terms of its effect on sexual function, the risk to losing ejaculation is extremely rare, less than 4 to 6%. In terms of sexual function and erectile function, There is no risk from that point of view. So, what are the downsides? Well, as I said, it can be a bit more irritating than the Urolift in that initial period. If you want something that's going to fix you like that, then the REZUM is not the right option for you. If you know that there's going to be a month and things are going to get better with time, then this is a great minimally invasive option. Who do I think should choose this? Well, because we are removing tissue with the steam, I do think men who have slightly larger prostates do benefit from this compared to the Urolift. And there is growing evidence, even in very large prostates, that there can be benefit with this technique. Men who have median lobes can also be treated more easily with the REZUM rather than the Urolift. Men who are concerned about effect on their sexual function, men who don't want to have a complete general anaesthetic. These are the people who I see really benefit from this. If you do have pre-existing irritation in your bladder, sometimes we do need to be aware that in the initial period after this, there can be some worsening of this and that we would need to manage this. Sometimes if you have a smaller prostate, we may also discuss whether or not the Urolift could be a better option in this situation. So having talked through all of these options, the big question still remains, which treatment is right for you? And this is a very personal decision. You should take your time, you should not feel rushed, and you should be presented with options. If you're only given one, it's very hard to weigh up the pros and cons of these. You also need a proper assessment. What I find with these new procedures is technically they're not very difficult for a well-trained urologist, but the expertise does come from guiding people to the right treatment for them and giving them the right advice and discussion. Now, this video is not meant as medical advice, but rather my opinions and as a way to start your pathway to your best treatment. So make sure you take your time to read this. On my website, I have further information about all of these, including more detailed assessments and also information sheets. It is important to know that seeing a urologist and being properly assessed is a key part in terms of deciding what treatment is right for you. I am often asked about costs, and obviously this part of the presentation is very specific to New Zealand in 2021. But unfortunately, within the public health system in New Zealand currently, these procedures are not generally widely available. In the private system, they are funded by most private insurance companies, and if you do have Southern Cross insurance, recently we've worked on a pilot program for this now to be funded for you. For those who are wanting to self-pay, we can always give you a quote for this. Unfortunately, it is quite an expensive procedure, and a lot of this is driven by the equipment because it is all single-use and technically advanced equipment. I thought I'd just add some thoughts on some of the other procedures which I haven't discussed here today, but you may read about. The first of these is the iTind. This is quite an exciting device, but the long-term data is not there yet, and so I haven't adapted it into my own clinical practice yet. It does excite me as it is the only truly removable device that could be placed in a clinic, and so I do see this as a good option and will watch it with interest. The other is PAE, or prostate artery embolization. I had a lot of experience of this when I worked in the UK and was part of helping look after patients who were in a trial registry. It's performed by an interventional radiologist and involves putting needles into the groin and cutting off the blood supply to the prostate. It, I find, is very good for men who have very large prostates who want to avoid general anaesthetics. Robotic surgery. Robotic surgery in New Zealand is generally used for removal of the whole prostate for cancer, and this is quite different from men urinary symptoms. Sometimes in men who have very large prostates, it can be used. The experience of this in New Zealand is very limited compared to particularly overseas or America, where it's becoming a much more common procedure. This is in part due to our longer experience with using lasers for very large prostates. So, having watched through all of this, you've done well. What are my final thoughts? Well, as I said throughout this is very much your decision to make. You should be aware of your options and make the decision that is right for you. And above all, it's the bother that the symptoms cause that will dictate how you choose. Now, I'm always keen for feedback, and if you have any, post it and let me know, and you can go to my website to see anything further. Thanks. As I said again, this is just my opinion. It is not medical advice. You do need to be properly assessed to make sure that you're right for any of these techniques. And as I said, any decision is what we call a shared decision-making process. It's not me, the doctor, saying you need to have this. It's you and I together making a decision that's right for you. As I said, if you have any more questions, you can make contact, book an appointment, or you can check out my website.